Hi, I'm Bill Schmick. Welcome to 30 Minutes.
Welcome back. I'm Bill Schmick, and this is part 2 of Medicare. And the last segment, we covered Medicare Part A, Part B, and the drug prescription Part D. So if you missed that, I urge you to go into the GNAT website, take a look at it, and review it. Because the bottom line there was that unlike what many people think, Medicare Part A, B, and D is quite costly. It's not a free program. It is not Medicaid. And so I went through exactly what the premiums, co-insurances, what you'll be paying for each area, A, B, and D. And I ended up listing for you roughly what these costs should be, whether you're single or with a spouse, so forth and so on. But what I did is after the show, I kind of actually went back and added up what, the typical person in good health who is 65 years old might expect to pay for Part A, B, and D, the prescription drug area. And so here we go. Well, I'll take myself, for example. I got my left knee replaced this year, okay? And I got my right knee replaced 2 years ago. And as you probably know, hip replacements and knee replacements are common in the United States today. And actually the surgeries are accelerating as the technology makes these surgeries less and less dangerous. So let's take me. Now, I told you that in Part A, which is Medicare Part A, which is basically your hospital stays, okay, you have a hospital deduction of $1,316. So let's say you go into the hospital this year or next year for 2 or 3 days, okay? Automatically, $1,316 you're going to pay. Now, with all the medicines and everything else in the hospital and afterwards, you're probably going to pay another $1,000 in co-pays or co-insurances, okay? So that's your Part A. Part B, remember, you're paying a premium for Part B every month. So let's say you're paying $134 a month, which would put you making less than $80,000 a year, okay? Or, probably $170,000 if you file jointly with your spouse. So what does that come to, okay? If you're making less than $85,000, your yearly premium for Part B comes to $3,216. If you make over $85,000, for example, it could double. It could go up to $4,500 a year or more. That's 2 people, once a month, times 12. Okay, so let's say in addition to that, in Part B, as I told you last time, after you pay your deductible and so forth, you pay 20% of any medical costs that you may have. So let's say you rarely go to the doctors and your wife or husband rarely go to the doctors, but you go 3 or 4 times a year for blood tests, whatever. So I'll take a very conservative number for the 2 of you, $750. Okay, so that's the cost of 20% of your medical cost, plus your premiums, I said, so forth and so on. Now, Part D, your drugs, okay, let's say you both have a chronic condition, but they're minor, okay? And you can get a generic form of a drug. So let's just say that for one of you, it's $50 a month, and for the other is $25 a month at max. So basically, with the annual deductible for prescription drugs, which is $400, and you multiply that by 2, it's $800, okay, for 2 of you. There's a premium for Part D most of the time, which is the lowest is $53.50 a month. So we'll multiply that by 12 times you and your spouse, $1,284 a month. All of this all together, this is for 2 people per year who are comparatively healthy, and once in a while they'll have to go to the, like I did for joint replacement or something like that, or you break your arm or whatever. Anyway, right here, it's $9,152 a year, okay? That's the numbers for somebody that's really, two people that are really healthy, that gets in, that have no problems, that don't fall down the steps, that have no chronic injuries, all the rest. $9,150, okay? That could easily go to 10 grand a year, easily. This is after-tax money. Okay, so let's say you're two on Social Security, and what are you making? Well, let's just say, because I use conservative figures here, let's say you're each pulling in on Social Security $36,000 a year, or 72 grand, okay? So 72,000 for the combined, and you're paying almost 10 grand after taxes of that money, okay, just for your medical expenses. That's a big bite, and that's if nothing goes wrong, okay? What if somebody has cancer? What if somebody develops diabetes? What if they need a hip replacement? Both of them, like I needed 2 knee replacements. What if you both do? You're getting the point. And as I said the last time, there's no limit to the out-of-pocket expenses that you can pay under Medicare Part A and B. There's no limit, okay? A 72 grand you made in Social Security, gone. Could be just that fast. So, we know this. And so the subject of this program is how to protect yourself from that disaster. Now, there are 2 programs, Medicare Advantage, which is sometimes called Part C, which replaces Medicare, Part A, B, and D, replaces it. And there's Medigap, which supplements the original Medicare Part A and B. Okay, think of it as a gap. There, as we just talked about, there's a gap in what Medicare covers and what you pay out of your pocket, okay? So what Medigap does is it tries to fill in those gaps. Now, for Medicare Advantage, what basically happens is you go to the doctors and the bills are paid by your Medicare Advantage plan, pure and simple. Now, on a Medigap plan, it's different, okay? You go to the doctors, okay, and what happens is first the doctor bills Medicare, and then whatever isn't paid by Medicare, it then goes to Medigap, who pays for the rest, okay? So you might say right off the bat, well, why don't I get them both? Well, the thing is, unfortunately, that they don't work together. One or the other, not both. Okay, so let's start with Medigap. Watch the gap, please. Now, these Medicare supplemental plans, Medigap, they're sold by private insurance companies. They fill the gaps, as I said, between Medicare coverage of Part A and B, paying some, and in some cases, all of the costs that original Medicare doesn't cover, such as deductibles, co-pays, co-insurances. But in Medigap, it does not cover prescription drugs. So, if to think about it this way, you're Part A plus Part B, okay, plus Part D, that's your original Medicare, okay? So Medigap just fills in the gap, okay, in addition to those. So, and they will limit, Medigap will limit what you pay out of pocket. Whereas, as I just said, under Medicare A and B, there's no limit to how much you can pay out of pocket. Now, as you might imagine, the better the plan that you buy, okay, the less you pay in medical cost. That's free markets, that's capitalism. The most comprehensive Medigap plans will pay all the costs that Medicare doesn't cover, but it doesn't cover prescription drugs, remember that. But in return for all of those costs, you're going to pay a higher monthly premium than plans with, say, less comprehensive coverage, okay? But once you pay the premium, the plan pays all the rest of the cost. So that in many plans, you go to the doctor, it costs you nothing more. You go to the hospital 10 times a year, doesn't cost you, okay, it's free, whatever. Now, you sign up for Medigap insurance, usually about, you have, I think in most states, if not all states, you've got a 6-month period from the time you're 65, and you sign up for Part A and Part B, which you have to do. Well, you don't have to sign up for Part B if you're privately insured, but certainly A. So, if you're going on the Medicare route, Part A and B, you have 6 months after signing up for those at 65 to sign up for Medigap. Now, each state has its own rules of really when and how you can buy Medigap policies, although it's available to everybody in the country, okay? In some states, you have a limit on pre-existing conditions, okay? For example, my friend that had diabetes, okay, if he were to sign up for Medigap, there are some states which would say, oh, diabetes, that's a pre-existing issue. Sorry, but you have to pay your own bills for the first 6 months of signing up for Medigap. Others, in the different states, whatever your pre-existing condition is, from day one, they pay for it, okay? So you're gonna have to check with your state Medigap office. It's in Medicare. They'll explain to you. If not through Medicare ARP, you can go there. Anyway, it'll list every state, what the rules and regulations are, and you should do that. Go on the internet or whatever. Now, as I said, Medigap is a good program, and it does limit your out-of-pocket expenses. The other option that you have is Medicare Advantage, which some people call Medicare Plan C. Okay. Now, as I said, what this plan does is think of hospital coverage plus medical coverage plus drug coverage, all three in one program, Medicare Advantage. Okay, so all three are covered, okay? There's conditions. First of all, in order to qualify for Medicare Advantage, you also have to enroll in Medicare Part A and Part B, okay? Just like Medigap. Now, you'll pay, in addition to the insurance, the Medicare Insurance Advantage, you'll also pay premiums for your Part B. So whatever your premium was, and I've gone through them before in the last segment, you'll pay that Part B premium per month. If you're married, you'll pay, and she or he is also on the plan, you'll pay it by 2. Okay, so the Part B premium you're going to continue to pay, okay? Plus, for Medicare Advantage, you're going to also pay either a monthly premium for the Advantage insurance, or you'll have a deductible. In addition to either the premium or the deductible, you're probably also going to have to pay a copay or a co-insurance. Just about all the plans are like this, okay? But the good news is that just about all the plans have a maximum that you're ever going to pay out of pocket, okay? Including, without one exception, prescription drugs. There is no limit on those. Okay, so the Advantage will give you a number that will limit your out-of-pocket expenses for anything covered under Part A and B. They will cover your Part D premiums. The only thing they won't do is guarantee you an out-of-pocket maximum for your total drug cost. And this brings into mind this donut hole that I talked about in the last segment, okay, which can mount up and mount up and mount up. Okay, so with that exception. Okay, as I said, the Medicare Advantage option gives you all the benefits in one single plan. That means you get hospital care, medical care, the prescription drugs. Some also offer vision care and dental care and even other services, okay? As I said, they give you financial protection by placing a limit on what you pay for Medicare care during the year, but it's 1 year, okay? Resets year 2. You'll pay co-pays or co-insurances for sure. That's after the premium or deductible. But once you pay them, those are your out-of-pocket limits, the plan will pay 100% of your medical costs. Again, as I said, it does not include limits on your prescription drug costs, okay? And we all know, prescription drugs have up 11% last year. Now, the Medicare Advantage, you may have heard of this. Each one of them has a provider network, okay? And what that means is if you'll pay less if you receive care from doctors and hospitals and other providers that are in the plan's network. They promote these networks of doctors and hospitals and so forth, and they've got separate deals with them. So if you go to those, naturally you're going to pay less. Now, they do that in order to control cost from their end, and also this way they can coordinate care for a lot of patients. So, and all these plans have a star rating issue, okay? So you'll go and see that this plan has 3 stars or 4 stars or 5 stars. And the more stars, the better they are and more patients they attract. And the higher the star rating, they get bonus points from Medicare. So a tip, look for high star rated Medicare Advantage programs. You might ask, well, how do I choose a Medicare Advantage plan, okay? And some of these are common sense, but for example, you would first look for your doctors. You look at the insurance, Medicare Advantage insurance plan, and you would see if your doctors are listed on that, okay? So let's say you go to 3 doctors or 4 doctors, as lots of us do after they're 60 or 65, and 3 out of 4 doctors show up on this Advantage plan, but the most important doctor isn't. Now you're going to have to make a decision. Okay, are you going to change doctors? Are you going to find another one in order to qualify for the plan? So this is number 1. Figure out what you want to do doctor-wise. Next, hospitals. Okay, as you know, not all hospitals are equal. Not all hospitals are close. So you'll pick a plan, you'll look in the network and see if your favorite hospital, the one closest to you, the one with the best reputation, whatever it is on the network plan. Maybe it is, maybe it isn't. So what do you do if it isn't? What if your doctors are on this plan, but the favorite hospital is not? It doesn't happen often, but it does happen. Are you going to switch hospitals? Would you be willing to do it? If there's a good hospital, but it's an hour and a half away, you're going to have to make those kinds of decisions. What about other providers? Do you go to a physical therapist? Do you go to one often or some other service provider? Are they in the plan? And if they're not in the plan, what about switching? That's another decision. Okay. Pharmacy. Your favorite pharmacy. Mine is, right down the road from me, okay? Is it in the network? If it isn't in the network, once again, you're going to be asked, are you going to switch? Would you switch? Is it a preferred pharmacy, which means that you're probably going to get a discount on your drugs or not? So, another decision. You either keep it, let's say all your doctors are there, your hospitals are there, but your pharmacy isn't. It's pretty simple, okay? You got a dozen pharmacies to pick from. Pick from a preferred pharmacy, okay. Look at it, step back from the plan and say, does this plan provide good coverage of all my health services that I use regularly? If it doesn't, it's probably not a good plan for you. But don't keep it to just what you're getting now. I'll take my old friend with the diabetes situation. Okay, of course, he didn't know he was going to get diabetes in the future. He did, but maybe there are some illnesses that don't require right now prescription drugs or treatment now, but may in the future. A lot of us, as we get older, there are chronic illnesses that will crop up. We know them. How well does this particular plan cover those kinds of instances? Okay, so you've got to do some future thinking about the plan, your Medicare Advantage plan, and what you may need in the future. Of course, the future is unknown, we know that, but there may be things that you may be able to surmise from your own health or your spouse's health that you might want to include in your decision. Does the plan cover in Medicare Advantage all your prescription drugs? Okay, this can be very, very important to you or I. Okay, I only take one prescription drug. That's a generic, it's not important to me now, but it could be important to me in the years ahead. And the other thing is, not only does it or does it not cover the drug you take, but what's the copay for that? As I explained in the last segment, each Part D company has a formulary that is a list of drugs, and then each drug is put into a tier, and the different tiers charge you different co-insurances or co-payments. So if you've got a drug that you need to take, and in this plan, this Advantage plan, it's in tier 3, and you're going to pay $90 a month for it, whereas in that other plan, it's in a tier 2, and you're only going to pay $30 a month for it. This is a cost that is significant, and you've got to take this in account when you're looking at your Advantage plan. Okay. Do you want or need extra benefits such as dental or vision care? Okay. Medicare Advantage plans usually offer you those things, and here's an example. 25 years ago, I got a lot of dental work done. I didn't know this, but in most of that dental work, no matter how well it's done, all sort of expires in 20 or 25 years. And so suddenly in the last 3 or 4 years, I've had to get all my fillings replaced and this, thousands and thousands of dollars, okay? You may be in the same issue, okay? But it hasn't occurred to you yet. So dental may be important if you're expecting to have to pay $2 or $3 grand a year for 3 or 4 years for dental work. Okay. How much will you pay per month and per year for medical benefits and prescription drugs? They'll list all of those things, okay, in your plan. And when you do look at this, take into account the premium, the deductible, the co-insurance, the co-pays, and add it all up, which they will do for you, of out-of-pocket limits, okay? So how much maximum can you pay? What's the upside? What's the downside? Now, a lower premium plan, depending upon your health needs, okay, it may be the most affordable plan, but if the copays are high for the same medical services you use frequently, it may not be the best plan. Do you see what I mean? So just the low premium, don't just focus on just this plan's got the lowest premium, I'll take that. If the copays and co-insurances are way high, and you'll end up behind the 8 ball because the money you saved on the premiums went out the door in copays and co-insurance. So that's really important to you. Now, how do you choose between Medigap and Medicare Advantage? Okay, obviously, if you haven't figured it out by now, one size does not fit all. Okay, now Medicare or Medicaid, you've got to kind of look at the differences between the two. Medigap is, as I said, original Medicare, which you pay, plus Part D, prescription drugs, which you pay, and then Medigap, you pay for the gaps that Medicare A, B, and D do not cover. Okay. You got to know that any doctor who accepts Medicare will accept Medigap, so just put that out of your mind. Okay? Also, Medigap programs, because of that, because Medigap and Medicare doctors are basically the same coverage, you have a lot of flexibility to choose which doctors and services you're going to have, and this is especially important if you travel a lot around the United States and its territories, okay? So Medigap may work better for you if you're a frequent traveler, or if you have two homes, you know, you're a snowbird and you got a place wherever and you got another place in Florida. It may work well for you because, as I said, all doctors should be covered by Medigap, okay? So those are some of the advantages for Medigap, whereas in Medicare Advantages, okay, or Medicare Part C, number one is most plans, all you need, they're all covered. It's like one-stop shopping, okay? And then two, the most important thing is in the Medicare Advantage is to find a key provider, someone in the network that you feel most comfortable with, that the plan in Medicare covers everything, okay, that you would possibly need. So, you know, that's pretty good. It's one-stop shopping, whereas Medigap, you're paying A, B, D plus Medigap. You probably have to probably show 2 or 3 insurance cards at a time, whereas Medicare Advantage, one card fits all. Okay, the cost, okay? Now, Medigap premiums are more expensive, as you might expect, than Medicare Advantage. So the premiums are higher in Medigap. Now, also remember that not only are the premiums higher, but you're still paying Part D premiums in Medigap, right? So Medigap plus Part D. But once you pay all the Medigap premiums, the cost for medical services is roughly less than Medicare Advantage, okay? Higher premiums, but after all of that, the costs are usually less than Medicare Advantage, all right? Some plans actually in Medigap, after you pay the premiums and so forth, you pay nothing for a hospital visit, nothing for a doctor, nothing. Whereas in Medicare Advantage, the premiums are lower than in Medigap, but it also, remember, it also includes prescription D premiums, so you're also not paying for them because you're paying them in the Medicare Advantage premium. But what'll probably happen is your out-of-pocket deductibles and co-pays will be higher. Premiums lower, deductibles, co-pays higher, the opposite with Medigap. So, as I've been saying, you're going to need to work on this, which is best. If you don't need frequent care, if you're really healthy, maybe Medicare Advantage is the best one for you. Especially if you find a plan that really fits, has really good coverage and services that you need the most. If you can find a Medicare Advantage plan like that and you're in really good health, and hopefully, God hope that you'll stay that way, probably Medicare Advantage is the way to go. However, if you have a serious illness or an accident, okay, Medicare Advantage is probably going to hurt, and you're going to have to probably pay your out-of-pocket maximum for it. Now, convenience, as I said, you know, with Medigap, you're going to have 2 or 3 cards to show your health care provider. With Medicare Advantage, it's, as I said, it's just one card, and that's no big deal. So basically, it depends on who you are, who your spouse is. You got to get a good handle on what health services you need now, what's provided. You're going to need to do a lot of work here, as you can see. And as I said, if you don't want to do the work, you certainly can hire a consultant services. There's plenty of them that'll be happy to pay to take your $200 or $300 in order to do this analysis for you. It's probably worth that, okay? But if you're especially good at numbers, you're an engineer or something like that, and you like to get into the nitty-gritty, there's certainly all of this information on the internet, and I urge you to do it. So, painful, complex, hopefully I've kind of made a little bit of sense out of this for you. And if you have any questions about it, please don't hesitate to contact us. Thank you.